system. But before we do that, just a quick review. Doing like anything the reviews read. Right? Okay, so last week we talked that health is, according to the World Health definition, complete physical, mental, and social well-being, and not just the mere absence of disease, right? And then I didn't talk about this last week, so this is a renew. Just something to remember is that, we talked about individual health, but we also need to talk about population health. And that is the outcomes of a group of individuals and the distribution of those outcomes within a group, right? So when you look within a group, we'll just pick the population that looks like me today, the white population. There's wide disparity in the health, disparities between the health of different groups of people. Higher income, low income, rural, suburban, and so on. So we need to recognize that as well. Now, I'm not going to go through all the learning objectives, but the learning objectives as we go through the PowerPoint, each one of them, they're in an orange box. Orange objectives, get it? Okay, so trying to make it easy for me to remember, but kind of a short description that should tie back to what's in the original list up at the front. Now, I'm not going to guarantee that always happens because I move things around and forget the numbers changed. But I want to start off with a question to you this morning. What determines health? What's that? Genetics determines health, right? If you were born with certain genetic disorders, there's like genes for breast cancer, right? That if you have that, the chance of a woman getting breast cancer is greatly increased. There are other genetic disorders, many just genetic disorders as well. What else is going to determine your health? The environment that you live, right? So, I lived in Covington, Virginia. The main industry there, the industry there was a paper mill. Anybody ever been around paper mills? They stink. In paper mill towns, they call it the smell of money, okay? But the fact of the matter was that individuals who lived near the paper mill had a much higher incidence rate of cancer than people who lived further away from the paper mill, all right? So when we lived up there, we lived on the correct side of the paper mill because the wind blew from our house towards the paper mill. Rarely did we ever even smell it. So environment. What else is going to impact your health? Diet, what you eat, right? So things like diet, exercise, which we might in some sense say are behavioral, but it's not that simple, okay? We'll talk about that a little bit. What else?
Age.
What's that?
Age.
Age affects one's health. Fact of the matter is, we get older. When you get older, you're maybe not quite as healthy as you were when you were younger. I thought I was feeling bad when I was 30. That's when the things started, my muscles started to ache, joints started to ache. That just gets multiplied every single decade. So, feeling healthy, I hate to say it, it's probably not going to get a whole lot better for you unless your baseline is kind of low and you're able to improve it. Okay? So age impacts your health. What else can you think about? Might drive your health. Resources. So give me an example.
Like what town you grew up in? Like how far away is the closest cath lab if you're having a heart attack?
Okay, so access to healthcare services will have an impact on your health as well. What else? Okay, we're going to talk about some more. Alrighty, so that's a good start. But I think when you look at this question, it's there's a lot of things that will impact whether someone is healthy or not. And so kind of the complete answer to that is on the next slide. And I think we need to recognize that there are medical and non-medical factors that impact health. Okay, and when you put them together, They are typically referred to as the social determinants or drivers of health. Probably, if you've heard these terms, it's more likely that you've heard the term determinants of health versus drivers of health, but a lot of the literature now is starting to refer to it as drivers. And I think their reasoning is when you say something is determined, it's like you can't change that. It's determined. Whereas if you think about driving something, if your health is a vehicle, you can turn that and go in a different direction. So the ones they mentioned, we mentioned healthcare access, but another big one is education and access to quality, because what is often your education often determine or open up for you or close to you? Jobs, right? So when I was growing up, a long time ago in the 1970s, what percentage of jobs required a college education? Like 10, 15%, okay? And I don't really actually, some guy told me this because he researched it, and it was like, 10, 15% of jobs, you needed a college education. You had a good high school education, you did skilled jobs, you learned them on the job, maybe went to a trade school and could be very successful at that. Now, what's the difference today? You kind of have to have a college education, right? And sometimes for a lot of jobs, that college education ain't good enough. You need to have a master's. Other jobs, you have to have a PhD just to get into those jobs to begin with. So education is more important. It gives people an opportunity then to have a higher economics. And you have higher economic levels, what does that mean? You might have access to health care, right? Maybe choosing what environment you live in. You may have more knowledge about what healthy behaviors are or not. So it provides economic stability. And then where you live, again, that's related to environment, right? But think about it. If you're born in some place that's relatively unsafe, you can't go outside and exercise because you're scared something might happen to you or your children. That impacts your ability to exercise. And it may impact your ability to access things like food. You ever heard of a food desert? Right? Dr. Wilson teach you all about food deserts yet? Okay, then I won't talk about them. But from my perspective, I used to think, well, why don't people eat healthily, right? Well, until I was in a health policy fellowship with the American Osteopathic Association, and we were taking a class down in Fort Worth, Texas, and one of our people who came in and taught us came in and said, we have these things in Fort Worth called food deserts. Large sections of our city where there's not a grocery store. And the only food that people have access to is stuff you buy in a convenience store. Fresh vegetables, and maybe some iceberg lettuce. They showed us pictures of the food that was available. Fresh meats, maybe some pig feet. That was about it. I don't know if you ever watched Diners, Drive-Ins, and Dives. Apparently, it's a great cooking show. But apparently some restaurants can do wonderful things with pig's feet. Usually when I think of pig's feet, you use them to test, suture, as a suturing material or to practice suturing. So, that's important. Your family context is important. So those are the things that, are kind of recognized as the social determinants or drivers of health. Now, what impact do these have on health? That's a nice picture from Healthy People 2030. Same list of things, I think, if I did it right. But when we look at our overall health, I think a lot of times we think that having access to healthcare is the most important thing. Don't we? I mean, maybe, but it's not. According to the studies, and I'll show you another example of one, having access to actual Medicare only impacts about 20% of health, according to the academics. And the social determinants and things like genetics, well, genetics is kind of above the social determinants, The social determinants itself, which I'm gonna, different people group them in different ways, so, but if you take the medical care, oh man, I got the timer going on me again. All right, if you take the, that means I was talking to you on that slide. If you take medical care out of the social determinant list over here, about 50% are the other social determinants. And this study was a meta-analysis done back in 2014, so it's almost ancient history. But what they note, again, the impact of medical care is somewhat limited. And they also put an emphasis on behaviors. And we're going to talk a little bit more about that. So if we're going to focus all of our policies just on the medical care system or the healthcare system, what's the impact that we're going to have overall on improving individual or population health? Not as much as it could be, right? So we have to look at other things. Now these comments are, many comments, and I'll point out, are from a political scientist. Okay, can't believe everything a political scientist says. This is one person's view of things. But I think the first one's true. Good health care does not necessarily create good health. And health is often a result of your heredity, right? Your genes. It's your lifestyle, what you do or do not do. It's the environment that you live in. Now, was that a new idea? Now, Hippocrates said this like 3,000 years ago, right? I don't think Hippocrates did not know about heredity, but he certainly got lifestyle and environment. And then you think about, as a healthcare provider, probably a frustrating thing is that oftentimes your patients do not listen to you, right? There's only so much you can do. You can tell people what they should do, but they have to do it. And oftentimes, and I know some of you all probably scribe in ERs, right? And you have people who kind of like come back again and again and again. And what are they coming back for? The same thing they came back before. Maybe it's because they don't have anywhere else to go, but perhaps it's because they've never taken the advice of a healthcare provider to change things. There's some things they may not be able to change. And overall, it really, the healthcare system has little impact on things like infant mortality, lifespan, and overall sickness, right? So you have to look beyond the healthcare system for solutions. Because, think about infant mortality. When a mom comes to the hospital and she's never been in the healthcare system, what influence has the healthcare system able to have on the health of that baby? Often none. So, the question is, okay, how do I make sure that women have access to prenatal care instead of just showing up in the healthcare system and the healthcare system being caught often with things that are very tragic, right? So that's kind of a challenge that is there. And then this guy, his name's Dr. Dye. He goes, D-Y-E, not D-I-E. If you want a long, healthy life, choose parents who lived a long, healthy life, and then do all the things your mother always told you to do. Don't smoke, don't drink, get lots of exercise and rest, don't overeat, relax, and don't worry. Now, what's the problem with that definition? Now, there's some truth in this definition. What happens if you don't? What's good?
I was just saying, one problem is you can't choose parents.
Well, you can't choose your parents. You can't choose your genetics, right? You may grow up in an environment where everybody smokes, everybody drinks, they don't have access to good food, they can't go outside and walk even for exercise, and they may live in an environment that is highly stressful for whatever reason. So this is kind of like ideally, right? And the chart I showed you before about the influence of behaviors. I think it's helpful to recognize that often our behaviors are a result of where we are. It's an influence of our environment. And not all. Some people are just knuckleheads, right? They know better and and they do it, they may even be able to address it, and they don't. But often, particularly those that I think that are impacted or their health is negatively impacted, they're just frankly in situations they can't change, or it's really hard to change. So we have to recognize that, because I think there is a relationship between social determinants and health equity. And the CDC defines health equity as is the state in which everyone has a fair and just opportunity to attain their highest level of health, right? So does everybody in this country have an opportunity to obtain their highest level of health? Nah, nope, not even within same groups. You know, I mean, there are Black people who have had access to education and do very well. There are a lot of Black people who don't. The same thing with the white population, the Asian population, the Hispanic population. There are variances in the opportunities that people have. So to create equity, we have to address these issues, right? Does that make sense? Clear? Okay. All right, so if we're going to address health overall, what might we want to do? If we think about the determinants of health, what should be our priorities? Well, what does the World Health Organization say? Which the United States is no longer a part of. I don't know if you heard that or not. We weren't before, then we were, now we're not. Anyway, but what the World Health Organization noted is that if we're going to improve health, we need to increase education, which you hope would lead to employment opportunities, and then also create the healthy living environments where people can thrive. Okay. I mean, you think about, okay, side trail, word rant. Okay, I do these from time to time. As you look at our education system, pretty much anywhere. Some of you had an opportunity to be in great education systems. Perhaps you went to school in Northern Virginia. Perhaps you could have went to a private school. Good education. You have opportunity. But we also have very poor parts of our system that are very poor, right? I mean, again, you spend 12 years in school. Just think this. You spend 12 years in school, and what are you qualified to do? Very low entry-level jobs. Now, sometimes that's where people start. Most people don't remain necessarily poor forever. You know, maybe one day they're flipping burgers, and next, a few years later they're the manager of the restaurant. Okay, so that type of thing happens. But we have not our undergraduate, but like our high school system basically prepares you for nothing unless you have a background where perhaps your parents are interested in education. They're supporting in you that you have good schools so you can go to college. But high school doesn't even prepare most people well to go to college. So personally, if I was going to change one thing to improve health, I make sure our high schools prepare people to do something. There's nothing wrong with a trade. You don't need to have a high school education. I mean, there are programs, I got several that I can give you examples of. Being a ship welder. Welders make good money, right? Being a lineman on, going out there, it's like a 4-month program, starting like $85,000 a year. That's like at the low level, and it goes up from there. And then when we have hurricanes, you make tons of money replacing power lines and so on. But I think that their priorities, they ranked it number 1 in the article that I read, and I think there's a lot of truth to that. That's my opinion. All right, so if we're going to address the 50%, what I want to suggest is that you think about, as a healthcare provider, not only taking care of your patients and their medical care, but become what is known as an upstreamist. So think of it. I'm not going to try to show one of these videos. I encourage you to watch the one on the bottom. It's just better than the one on the top. I don't know why I put them both there. But you think about healthcare, right? Okay. People out there living their lives, and all of a sudden they get thrown into the river of life. Bad things happen, and they fall over the waterfall into the healthcare system. And y'all are supposed to do something with it, right? So basically, the concept of an upstreamist is you look at those things up above the waterfall. Why are people falling in the river? And what can you do to keep people from falling in the river to begin with? It's pretty simple. I mean, it's basically a public health approach to improving population health. So, as y'all work on your poster presentations and so on in those projects, probably you can either pick a downstream approach or an upstreamist approach, and both of those are fine. All right. Any questions about anything so far? We're good? Okay. All right, another little quick review. Last week we talked about policy, right? What is it? Whatever the government chooses to do or not to do. And we know what they can do. They can tax us, they can tell us what to do. They can give us benefits like Medicare and Medicaid and Social Security. I kind of like the Medicare and Social Security. It's getting more attractive. They can fight wars if they want to. Don't like that. They can reward society members in whatever they want. And then this is an important review because you'll see this again, is what you need to do to effectively develop health policy, right? Based on values. It's not based on people's values. It's probably not going to go anywhere. You need to prioritize because you can't do everything. It's really great to have accurate information, though that is sometimes hard to attain. And you need to know what you're talking about. So if you're talking about Medicare for all, everybody understands what you mean by Medicare for all. We also, as kind of related to prioritization, is you need to recognize that everything you do is going to cost somebody some money, and who's going to pay for it, and how are you going to make this happen? We can have grandiose ideas, but can you afford it? I remember one time I was managing a construction project at a hospital, and we had an issue. And so I talked to the project manager there on the site, actually the site superintendent, and I said, well, why can't you just do this? He says, well, I can do this if you have enough money to do it, right? You don't have enough money to do it that way. So we always have to consider that. Remember that we always want to benefit more people than fewer people. We want to have short-term achievable goals. Because if you're trying to sell something politically, and you can say, well, we'll get this done in 10 years, who cares? People want something that they can see almost immediately. And that when we look at the Affordable Care Act, we'll see that there are things that were in government speed, almost done immediately within 2 to 3, 4 years. And then we have to consider the political complexities. So what we're going to get into is, what are the challenges of effective policy development? Because I think we all kind of know what the right thing is. So what are those challenges that we face? One is trying to address conflicting values. Values, people have all kinds of different values. You may agree with somebody on one thing because your values match, but then on another topic, you may be 180 degrees from each other. It's hard to change often what people value. We also sometimes have difficulty in saying, what is the real problem? And then, can the government fix all our problems? No. When did the war on poverty start? You remember the war on poverty? Probably not. There's no reason why you should. But it started back in about the same time that Medicaid started, back in 1965. And so the U.S. government has been fighting poverty. They don't always call it the war on poverty anymore. Been fighting poverty since 1965. That's a long time ago. That's most of my life. Do we still have poverty? I'd say we do. So it may make things better for some people, but it hadn't totally addressed the problem. We can't look to the government to solve all our problems. And then, with policy, we have to recognize that somebody's going to be advantaged and somebody's going to be disadvantaged. Talk about that a little bit. And then again, it cannot be separated from the political process. So I'm not going to talk, I might be talking about all these. We're going to talk about at least two of them. So conflicting values. What conflicting values are there that are out there? Right? Some people believe that less government is better than more government. There's some people who do believe that the government is the answer to our problems, right? I think with the current administration, their kind of view is perhaps less government is better. Maybe government needs to be more efficient. And is that wrong? Well, we'll see. But, people divide on that. Some people, take a more individual focus. It's about individual freedom. Whereas others may be more focused on what's best for the group. Those are two different views. And in the United States, you also have to recognize the historical. What happened historically? Go back to the American Revolution. Now, the revolutionaries, you might say, were, if you have to put in one, were they group focused or were they individualistic? Or in other ways, oh no, let's go back. Go back to my first point. Less government versus more government. Probably less government, right? Because they didn't want to listen to what King George said. Okay? He was taxing them and doing stuff without asking their opinion. We don't, well, one, we want to write our opinion, have some input into how we are governed. But King George seemed to be a stubborn man and wouldn't let that happen. And so, who moved to Canada? All the people who liked the king, telling them what they were going to do. And so, in a sense, our history of our country, or the way we address problems now is influenced by our history in this issue and other issues as well. I mean, Canada still is, I think, part of the Commonwealth state. I mean, they were until I can't remember the exact history, but there are a lot of countries out there that were part of the empire who sort of still are. Then we the individual group focus. Then we have cultural differences. Okay, the cultural differences in the South and the North are real, and then and in our country we've got a whole lot of other cultures coming in, right? And and again, it's formed by the history of the country. So who largely settled the South? Scots, Irish, settled a lot of the South. I mean, you get some French come up from Louisiana and so on. But the people from Scotland, what were called the borderlands of the United Kingdom, or whatever they were called at that point in time, were described in newspapers as being, well, unruly, mischievous, independent, having all kinds of bad behaviors. And a lot of them left and came and settled the South. And they were very, again, individualistic. They wanted to go with what they wanted to do. I mean, in fact, in Floyd County, which is immediately to the south of us, I mean, it's like the government used to not even go down there because they didn't want to deal with the population that lived down there, who just wanted to stay down there, make their drink, and do what they wanted to do. So those things live on, and they live on, I think, a whole lot longer than we might recognize that they should. And then we have things like secular versus non-secular views, or religious versus non-religious views, maybe another way to look at that. I mean, so, in this country, controversial topic is abortion, right? Are people with, and you also need to recognize that there are variations within two groups, right? So, I'm not going to call them far right, far left, but I'll say they're, if you think it from a Christian perspective, there are those who believe the sanctity of life. Life begins at conception. Are you ever going to convince them that abortion is okay, except maybe in limited circumstances? Then there are others who believe that the woman should choose. Are you ever going to change their mind? Probably not. But there's also, so we have to recognize that conflicting values really makes it difficult to get anything to move forward on a lot of issues, because if one set of values is adopted, it's at the expense of another set of values. And sometimes it's hard to really define what the problem is. I mean, we think about health. Is the real issue access to health care? For some people, yes, but not for everyone. Is more the issue education and giving people opportunity to be successful in life? Maybe. And when we think about the opioid crisis, and this is an article from somebody wrote about West Virginia, and what's the problem here? Is it just the culture? These people who just do drugs? Well, maybe there's small groups that do that. Was it the depressed economy? Was it a lack of education? Or was it just the overprescribing of opioids? So, really, what was it? Was it because, again, a little history. When Barack Obama became president, one of his quotes was, we're basically, not exactly, I'm paraphrasing, we're going to destroy the coal industry. And we'll replace those coal jobs with green jobs. Well, what actually happened, mostly, we destroyed coal jobs, which paid well, really didn't require a whole lot. You could probably just have a high school education and take care of your family really well. And the green jobs never appeared. So if you've got men, women who have been working, supporting themselves, and now they can't, how does that impact people? Does it cause despair? Okay, so was part of the opioid crisis related to despair from a collapsed economy? Not to argue whether getting rid of coal is the right thing or not, but you can argue both ways. There are different arguments on that based on what people value. But there are other things. When we implement policies on the big scale, they often have ripple effects that we don't anticipate. If all you're looking at is climate change, and this is not a class on climate change, personally, I feel cleaner air is better than dirty air, and coal is relatively dirty. It might be the right thing to do for the climate, but there are other things that get impacted as well. Sort of, people. Just something to remember. And then, we have to recall that anytime you implement a policy, it basically is going to advantage someone at the expense of others, right? So if we expand healthcare benefits for some group, well, who's going to pay for it? Well, there's actually two options at the federal level. They'll just print more money. When they print more money, what does that cause? Inflation, right? And who's inflation going to hit? Everybody. Or they can just tax you outright, which impacts individuals or corporations that end up paying, have to pay the taxes. So when sidebar, it's like inflation. When the government decides to spend more money than it makes, it basically decreases the buying power of what individuals can buy every single time. So you may like the idea of student loan forgiveness. I get that, right? Or you may like the idea of expanding Medicaid benefits during the COVID epidemic. Okay, but you also have to realize that the dollar that you had at the beginning of the year is now only worth 92 cents at the end of the year. That was like 2 years ago, I believe. So, something to, when we do things, somebody else pays for it. I mentioned that before. And then kind of what just the example is often like we have things like the Patient Protection and Affordable Care Act, or we have affordable housing. Always ask yourself, more affordable to whom? Right? So if I build a house for myself, it's a modest house, and somebody builds a house that's going to be given to somebody who can't afford that modest house, does it cost any less to build this house than this house? No. What it means, so when they talk about things, is when they say affordable, it's affordable to somebody, but it makes things less affordable for someone else. Now, is that right? Some circumstances, I believe, probably yes. As a society, we should try to help one another. So just something to think about. And then it's like it's tied to this politics thing, right? We have Republicans, we have Democrats, we have Greens, we have communists, we have anarchists, we've got all kinds of group. And again, they all have very, very, various values. And so, I don't know if I shared this. Did I share this quote before from John F. Kennedy? No, I told you he was president back in 1961. But he said this, and we can apply this to healthcare. Let us not seek the Republican answer or the Democratic answer, but the right answer. Let us not seek to fix the blame for the past. Let us accept our own responsibility for the future. That's a bold statement, but it's hard to do, and it always has been hard to do. This guy named Plato, y'all heard of him, right? He said this: if you're not taking interest in the affairs of your government, then you're doomed to live under the rule of fools. I think it's still true today. Sometimes our politicians seem pretty foolish. In politics, is politics nothing other than the act of deliberately lying? From Voltaire, who was a French philosopher. Things haven't changed since then too much. What did Mark Twain say? How do you know when a politician is lying? When they open their mouths. All right? And he also said, I think, what is politics? Well, we'll talk about politics in a second. All right. So, and then George Orwell. Any of y'all ever read Animal Farm in 1984? If not, you should. The guy's kind of a prophet in many ways, I think. But he said, in our age, which would have been 1940s, 30s, there's no such thing as keeping out of politics. All issues are political issues. And politics itself is a mass of lies, evasions, folly, hatred, and schizophrenia. Right? So, kind of makes us, a lot of people are kind of cynical about the political process. So, what is politics? Now, one guy said, poly is Greek for what? Many. What are ticks? Blood-sucking animals? Insects? Okay. Politics. But I think probably a better definition, unless you're trying to be cute, is from a guy named David Easton, who said, it's the authoritative allocation of values for society. And authoritative, meaning that individuals must or ought to obey, right? We always obey what the law tells us to do, right? We even had a politician who was quoted yesterday saying, all this stuff that Trump did with his executive orders, we're just not going to obey them at all. We're just going to be civilly disobedient. It also involves allocation, the distribution that provides something to someone while possibly denying others. And it also is based on values, which requires some evaluation to see whether it works or not. So, we know policy is whatever the government decides to do. Politics is actually just the process of determining what that's going to be. Howard Laswell was a philosopher in the earlier part of the last century. He wrote a book called Who Gets What, When, and How, which is probably a pretty good definition of what politics is about. It was often, definition that has been used often. So, why is the process often ineffective? And this is a quote from a guy named Lester Turow. I think he was a economist up at MIT. Before I went to college in 1980, I had to read his book called The Zero-Sum Society. And all I learned in college, these are a couple of things that just popped out to me, even before I showed up at the door of the school. And I'm not going to read the whole thing, but I think the highlighted section there kind of points out what our issue is that we have a political process that is incapable of forcing anyone to shoulder the burden. Because what do politicians need? Votes. So if you tick off a good part of your population, what might happen to that politician? They may get to stay home in their district if they actually live there, which they don't always do now. We had a Senator, Nelson Rockefeller, who was from New York. All the Rockefellers from like New York and up in that part, but he was a senator for West Virginia. And before he was a senator, I think he bought a house in West Virginia so he could say he had one, because he could afford one, but he actually never lived there. But you have to, as a politician, you have to think, okay, they're into this because they like it. They like the power, they like the prestige, they like making decisions, they like being seen, or whatever their motive is. I think a lot of politicians really do want to try to help make things better, so I don't want to be too cynical about them. But they also have to live with the reality that I want to get reelected. So I'm not going to make this side of the room pay for that side of the room. And I'm not going to do it, well, I'll do it the other way. I'm not going to make this side of the room pay for that side of the room, because there are more people on this side of the room and I want them to vote for me. Okay? So something like that. And then we also, it's kind of related to that, a term that came from that book, or he used, I'm not sure he invented it, but a zero-sum game is essentially any game where the losses exactly equal the winnings. So for every winner, there's a loser. And winners can only exist if losers exist. That's pretty much how things work. So we had a football game the other night. How many winners were there? One, Ohio State. My next door neighbor went to Ohio State. I'll see him tomorrow. Be interested in what he has to say. He'll be happy. He gets upset when they lose. So, but that's like with anything often in life. And the question is how do you create that win-win for everyone? And then another thing that makes it, I think, quite difficult are these things called lobbyists. And these are just some numbers. This is kind of healthcare specific. And this is kind of a big number. Overall, in 2022, there were 12,360 lobbyists. And they spent $3 billion to lobby Congress and federal agencies. So it's just not, because we'll talk about how policy is developed, but you pass a law, you influence those who are doing that. In fact, lobbyists largely wrote the Affordable Care Act. And then you have the regulatory process where you take these vague statements over here and turn them into actually what is going to happen. And so lobbyists or industry spends money on lobbyists to make sure that the regulations they have an opportunity to educate legislators and regulators on perhaps what the legislation or the regulation should say. And in almost every single one of these years, healthcare was the largest spender on lobbyists. You find that surprising? I really don't. We'll learn this, but what percent of our economy is related to healthcare? About 17-18%, right? So that's a lot of money. I think we're approaching about $4 trillion. I need to update those numbers. In many years, they were the second largest. In a few, they were the third. And back in that was 2014 and 2020, 2012. So, healthcare spends a lot. They're often at the top. And when you look at top industries, I think this is actually for, I thought I updated this one. That's 2022. I'll leave that in there just for the 2024. The numbers pretty much stay the same. The number one top industry for lobbying is almost always the pharmaceuticals and healthcare products. Interesting. Insurance. The hospitals, nursing homes aren't, well, you know, it's a lot, oops, there's an error there. It's not 0.5 million. I think it's about 96, I can't remember how many millions there. But it's more than the health professionals. So, you know, on the health professional side of things, doctors, certified registered nurse anesthetists are really, really big. Osteopathic physicians, medical physicians, MDs, all of them spend a lot of money lobbying. And then HMOs as well. And then when you look at single organizations, pharma, which is just a single entity, placed third. Realtors are number one. Not sure what their issue has been. The Blue Cross Blue Shield is number 5. I usually change the rank. I don't change the blue column. So I have the American Hospital Association number 4, and then some others that are there on the right. Amazon number 6. Facebook, Pfizer, Alphabet, which is Google. They all spend a lot of money on lobbyists. What's your opinion on lobbyists? Should they be able to do that? Should corporations be able to spend a lot of money, give a lot of money to politicians to influence it?
It would be hard for politicians to know everything that they need to know without being informed.
True. But as a lobbyist, okay, these are companies that get paid. There are references here too. So they're in red. You need questions. So that's kind of end of the presentation. But you bring up a good point. Lobbyists can provide information to congresspeople or to regulators, right? They can be educators. But what are they going to educate them on? I mean, what's a danger? Bias, right? If I'm a lobbyist representing Lockheed Martin, who makes defense stuff, which we need, you know, whose interest is that? Does the lobbyist have at heart? Lockheed Martin, okay? And you know, again, just kind of personal opinion for me is like, you can go educate them all you want. There shouldn't be any money tied to it. So, well, I'm out of time. I'll save my stories for later. So, thanks for listening. Yes.
In your last slide on the presentation, it says the American Medical Association is ranked 7th for 121 million.
Mm-hmm.
Why is that 7th, not 1?
I probably got the number wrong.
Okay.
I've been having a little problem with that because my eyeballs, I don't see everything really clearly. So I probably missed that. I mean, you don't have to know these numbers.
Okay.
Yeah, the whole point, yeah. So in this class, please do not memorize numbers, right? There's about 4 numbers I want you to know. And I'll tell you what they are. All right, so, because numbers change all the time. And, but, just kind of remember the big points. The big point is a lot of people